Well, welcome to CardioBrief, a important but short and concise look at some of the new literature in preventive cardiology in the past week. I'm Joel Kahn, medical doctor, fellow of the American College of Cardiology, clinical professor of medicine, and clinician. Thank you for being here. Well, let's go to the first paper that made headlines. Quite a controversial one to kick off CardioBrief. Paper in the European Journal of Nutrition 2025. First author is Sari Black. Nutritional and health benefits of a partial substitution of red and processed meat with non-soy legume, a 6-week randomized controlled trial. Basically, you may not know this study was done in Finland, but in the 1960s, Finland had the highest heart attack rate in the Western world. They instituted a program called the North Karelia study, where they substituted beans instead of the beef and made other changes in the diet, plant-based margarine instead of butter. And they were able to drop cardiovascular risk by 85%, the famous North Karelia study. Well, it turns out the Finnish have gone back to some of their old habits. The average amount of red and processed red meat per week in Finland is 760 grams a week, almost 3 times higher than their government recommends. So for 6 weeks, they took 102 men and they either left them on their standard diet or they substituted for about 3/4 of their protein intake legumes like lentils instead of the red meat and processed red meat. It wasn't 100% substitution. They wanted to make this something that potentially could be done long term. So they still were eating some meat. And what they found was the amount of fiber went up dramatically, of course, the amount of polyunsaturated fatty acids went up dramatically, and cholesterol fell on those eating legumes all of a sudden. What was surprising to the authors is that weight also fell. So good news for those of you that like peas, beans, and lentils, whether you use them as your only source of protein, plant-based protein, or a partial portion of your protein and substitute it for red and processed red meat, data that health benefits do accrue and no downside was seen. Good news. Okay, we're going to go to a second paper, a systematic review. This was in the journal Hypertension from the American Heart Association. Magnesium supplementation and blood pressure, a systematic review and meta-analysis. In my preventive cardiology clinic, patients want to get off blood pressure medicine, or patients want better control and don't want to add more medicine. So this paper looked at 38 randomized controlled clinical trials involving just over 2,700 participants, a variety of kinds and doses of magnesium. On average, magnesium lowered systolic blood pressure by about 3 millimeters of mercury, diastolic blood pressure about 2 millimeters of mercury. Not major, but in the group that was hypertensive and was taking blood pressure lowering medication, the changes were actually more prominent, with blood pressure systolic reductions of about 8 millimeters of mercury and diastolic of about 3 millimeters of mercury. So in normotensive individuals and those with low magnesium, in those looking to avoid extra blood pressure medicine, and for those looking to avoid adding a second or third drug, magnesium, perhaps magnesium glycinate, 400 to 500 milligrams a day, might be well supported by this analysis. And finally, the real zinger, applied physiology, nutrition, and metabolism, led to headlines all over the world in the last 2 weeks. Animal and plant protein usual intakes are not adversely associated with all-cause cardiovascular or cancer-related mortality risk. And there were 3 authors from McMaster University, Hamilton, Ontario. Stuart Phillips, the second author, quite well known in the nutrition world. And they used a database from the United States called NHANES, but they used a database from 1988 to 1994 that finished accumulating follow-up data in 2006. So one question is, why are they using data that ended actually 18 years ago, 19 years ago? Rather interesting. Then there are issues of the study setup I'll talk about, but the findings were that the higher meat intake versus plant intake was not associated with a reduction in all-cause mortality, was not associated with a worsening cardiovascular mortality, and there actually was a mild protection from cancer death in this study in the way they set up their analysis. And this created headlines. Meat may lower cancer risk was headlines all over the world in variety of media. Well, you do have to go to the bottom of page 7, and you will see that the funding information indicates that the National Cattlemen's Beef Association was responsible for funding this study. It raises some questions. And if you go just above it, several of the authors have a long tradition of receiving industry funding, the Dairy Council, Dairy Farmers of Canada, Nestle Health Sciences, and Cargill. So it raises the question if there could have been any conflict from the authors in their funding. Furthermore, and just to finish up, this exact same database was used for a prominent publication in 2014 that argued that increased meat consumption dramatically increased risk of death from heart disease and cancer. The first author was Morgan Levine, and the senior author was Walter Longo, PhD, University of Southern California. Well, I spoke to Dr. Longo about this paper and sent it to him, and he was shocked. They used the same database we used. They totally changed the criteria for analysis and was not as complimentary as he might be about the publication given the conflict. So you do with it what you want, but when you're seeing headlines that meat prevents cancer, be skeptical, ask questions, and wonder if there was some bias involved. Well, thank you for being with me for this week of CardioBrief. We'll see you again with new information next week.